And thank you for joining us for our weekly COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will discuss the various ways to get vaccinations, getting shots in arms here in Orange County. There are many opportunities out there provided by Orange County and other partners. He will discuss that. The mayor will also talk about opportunities for both COVID testing opportunities and for HIV testing here in Orange County. He will have details on blood drives and other health and safety items as well. Dr. Pino from the Florida Department of Health in Orange County is also here and will discuss important details regarding infection rates and state vaccinations. We'll begin with the mayor.
All right, thank you, Dr. Williamson, and thank you, Dr. Pino. We've been meeting now for many months and doing these briefings. Today is number 138 for us, and we continue to be laser focused in this community on increasing the opportunities for our residents to get vaccinated. And so today I want to highlight some of those opportunities that we have to ensure that we have equal access in all areas of our community. We know that there has been a decrease nationally in Americans getting the COVID-19 vaccine, and Orange County is unfortunately part of that trend. At one point this spring, we were vaccinating 10,000 people a day. Right now, the county is seeing only 3,000 individuals who are getting vaccinated each day. So with the help of our local media, we want to try to get those numbers up. One of my top priorities as we head into the summer and the 4th of July holiday is to continue to urge our residents to get inoculated. I ask our residents to make sure their families, friends, and neighbors are fully vaccinated to keep the coronavirus at bay. We'll be talking about the numbers today, but I also want to highlight, again, some opportunities tomorrow. In fact, across the nation, the president is putting a focus on increasing vaccination opportunities, and our First Lady, Dr. Jill Biden, will be flying into the Orlando International Airport and making a swing through Central Florida to promote vaccinations. The First Lady will head to the Kissimmee area and then to Tampa to highlight the importance of getting vaccinated. Now, I'll talk about Barnett Park, because as a county, we want to ensure that we continue to offer opportunities for our residents to get tested as well as get vaccinated. So if you haven't been vaccinated, there's a free opportunity at the Barnett Park to receive either Pfizer or the Johnson & Johnson vaccine. Our Barnett Park continues to offer free drive-through COVID-19 vaccinations and drive-through COVID-19 testing 7 days a week between the hours of 9 a.m. and 5 p.m. I'm pleased to announce that Barnett Park will remain open through July 31st for both of these services. We will continue to use some of our stimulus dollars to ensure that our residents have access. I'm pleased to also let you know that as far as testing for the coronavirus, individuals can select either the molecular PCR or the rapid antigen test. For the past week, our health services team tested 5,191 individuals there at Barnett Park. Barnett Park will be closed for the Independence Day holiday on both July the 4th and July 5th. Also, the I Got My Shot vaccine trailer is on the move. Perhaps you have seen it throughout Orange County. It will continue to go into communities that we believe are underserved. There are numerous chances for residents to get free coronavirus shots, again, either Pfizer or the Johnson & Johnson. On Monday, June the 28th, between the hours of 9 a.m. and 11:30 a.m., the trailer will be at the Villas at Hampton Park, located on Hillside Avenue in Orlando. Then on Monday afternoon, between the hours of 3 p.m. and 5 p.m., the trailer will be at West Oaks Mall in Ocoee. And next Tuesday morning, the mobile trailer will be at Goodwill, located at 7531 South Orange Blossom Trail, between the hours of 9 a.m. and 11:30 a.m. On Wednesday next week, the trailer will be at its usual spot at Lake Eola Park near the corner of Rosalind Avenue and Washington Street between the hours of 9 a.m. and 11:30 a.m. more than 300 residents can be vaccinated through the I Got My Shot mobile trailer each day. Next week, again, continuing the theme about making vaccine available. For North Paramore residents, there's a vaccination event starting Saturday morning right where you live. Free COVID-19 shots will be distributed at the UCF and Valencia College downtown campuses in the Paramore area. Residents can choose between Pfizer, again, or Johnson & Johnson. The event is part of what we're calling the Communiversity Vaccination Strong effort, and will also feature free food, gift cards, and other giveaways while supplies last. The event will be between the hours of 9 a.m. until 3 p.m. on Saturday. Among the sponsors are the Orlando chapter of the Links Incorporated, which is a women's volunteer organization, Second Harvest Food Bank, and the Boys and Girls Club and the Florida A&M College of Law. As far as our COVID-19 numbers for the past 33 days, well over a month now, our 14-day rolling positivity rate has been below 5% each of those days. Today, our rolling positivity rate remains at 3.7%, which is great news for our community. Even though we've seen a slowdown in the rate of vaccinations, what we are continuing to see is low positivity rates. The Florida Department of Health in Orange County reports that 57.34% of county residents 12 years of age and older have had at least one dose of the vaccine. So in terms of the numbers, we have not quite reached that 60% tile. However, Dr. Pino will tell you that if we had access to the data kept by the Veterans Administration for individuals vaccinated there, that number would effectively be higher, but we don't have the numbers. Since the start of the pandemic, there have been 145,487 coronavirus cases in Orange County documented. The number of deaths in our county has risen to 1,332. Blood donations are still needed here in Central Florida, and Orange County's Neighborhood Centers for Families will be hosting several blood drives tomorrow in partnership with One Blood. Blood drives are scheduled on Thursday between the hours of 9 a.m. until 2 p.m. at the following locations: the Eatonville Neighborhood Center for Families, the Central Florida Urban League and Pine Hills, and the Taft Neighborhood Center for Families. Again, for more information, you can go to oneblood.org for information. Saturday is National HIV Testing Day. As you know, Central Florida ranks among the highest metropolitan areas in the nation in regard to new HIV infections. Along with our Ryan White program, Orange County Government Health Services is dedicated to helping end the HIV epidemic by providing equitable, comprehensive medical, housing, and support services. It is important for everyone to know their status, whether they're HIV or not. To find a testing location services provided in your area, you can visit hiv.gov or orangecountyfl.hiv. And finally, I want to thank the Tangelo Park Baptist Church, Second Harvest Food Bank, True Health, and Impact Church Pantry for holding an event in Tangelo Park today that offered COVID-19 shots, personal protective equipment, and food to the community. Our Orange County staff worked very closely with these local faith leaders to provide tents and logistical support for the event. It took place in Commissioner Victoria Siplin's District 6. This was all part of the Cocoa Church of God 97th Annual State Convention Community Day. The annual state convention begins tonight, and we wish them well while they're here in town. And now, Dr. Raul Pino from the Florida Department of Health at Orange County.
Good afternoon, Mayor. Thank you very much. Thank you very much. This was not on. Before I go into the COVID-19 numbers, to continue what the mayor was last talking about, The 27th is National HIV Testing Day. There's going to be testing in several locations, but this happen all around in the entire year. It's needed for people to be tested so that we can prevent the consequences, infecting others, but also protecting yourself with early diagnosis. And just to let you know and reinstate that we do send testing kits by mail. If you need it and wanted to do in your privacy of your home, you can order a test at Talk Test Central Florida, talktestcfl.com. And there is a form there. It's probably is protected. It's privacy protected. That's why it's a .com. It's not a government-sponsored site. It's a private site to protect your privacy. And with that, we can provide you with a test by mail. Also, it's important for you to know that it's treatment to prevent acquiring HIV. It's called PrEP, exposure treatment, for those who consider themselves to be at risk or engaging in risky behaviors. There is a pill that you take once a day and will prevent you from acquiring HIV, and the State Health Department offers that pill and treatment for free or basically nothing. So you can come to us, we will engage you in the program and provide you with the medication. That program is in existence, and we are one of the few states that offer it for free. And we have 2 pills in that program that we can offer. So take advantage of it. It does prevent HIV. With regard to COVID-19, the mayor mentioned that we have a total of 145,487 cases accumulative in our county. Out of that, 143,110 are residents of our county. The mayor also mentioned that our positive rate is at 3.7, the daily, and the 14-day are at the same mark, 3.7, and it has been like that for over 30 days, and we're expecting it to continue at least for a few more weeks. We will see what the coming back to school, coming back from home into colleges, what that means for the pandemic, and that is to be seen. But also, it is important that we continue to vaccinate the younger segment of the population to prevent that spike from happening after the school start. And that's a hypothesis. It doesn't mean that it would happen, but we have to prepare for all the options. We have additional 5 deaths reported since we talked to you last. 2 female, 3 male, and 3 had pre-existing conditions. One of the deaths was from September, that was recently assigned from the state to us, and then 3 from May and 1 from June. Of course, our condolences to the family and friends of the deceased. Also, something new is that the Delta variant has been detected in our county, has been reported 12 cases of this variant in our county. None of the recent deaths were identified to have any of the variants that we know about it. With regard to the airport, over the weekend, the state contractor ended on Friday. The State Health Department took it on Saturday and Sunday for a gap, and then a new contractor started on Monday. And on the weekend, we did 640 vaccinations between Saturday and Sunday, and that's a significant number. The weekends are kind of slow travel days in our airport. It's supposed to start picking up on Wednesday, and it goes through Friday, the highest level. So we're expecting that to increase, and we are going to have these vaccinations for the foreseeable future. Of the international travelers that have been vaccinated, mostly are from Latin America, in case that question comes up. Large emitters of vaccinator has been Mexico, Brazil, Colombia, and Argentina. With regard to the vaccines, we have administered in our county 1,300,836, and the mayor mentioned to you that the increase from yesterday was 2,571. For Orange residents, just to give you a little bit of data, of all our residents, including all ages, 41%, 41.7% of all our residents had at least one dose. We are getting close to the 50% over all ages. That includes children that are not even eligible for the vaccine. We are at 41%, looking to get to that 50 for the entire population. For people 65 and older, with at least one dose, that is at 87.36%. So it's a very high number, and that's why we have seen such a decline in hospitalizations and death in our county. With the number that we are all familiar with, which is the number that the mayor gave to you, is 57.3% of all eligible residents of our county have been vaccinated. The mayor mentioned to you that I Got My Shot trailer is moving around the county. It has 2 to 3 activities a day. You can follow the trailer in the county website, and it also will tell you what it's going to be in the hours of those operations. With that, Mayor, any question that the press may have?
All right, we do have Commissioner Gomez-Cordero and Commissioner Wilson who have joined us today, and for the Spanish-speaking media, if we need translation, we have Ms. Ilia Torres here to do the translation. So thank you to those who have joined us. At this point, we'll open it up for any questions that you may have. There's the mic in the front.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. What can you tell us, Dr. Pino, about these 12 Delta variant cases as far as the severity of these cases, if these people are related, if they came from out of state or out of country? Any details you can give us on it?
You know as much as I do, because this is quite funny in the sense of we have our phone call at 1 o'clock with the mayor, and the mayor asked specifically for the variant. And at 1 o'clock, I said, Mayor, we have no cases. So I was preparing this report and reading through it, and then it comes a report from the epidemiology department. We got 12 cases out of the data. Mayor, I was wrong. We have 12 cases. And then after that, I came here. So I will have all that information at some point, but these are very fresh. Mm-hmm.
Troy Campbell with Channel 6. This question is also for you, Dr. Pino. With children under 12 not even eligible for a vaccine and the Delta variant going around, it's possible one of the 12 cases in the county is someone under the age of 12 years old. So what challenge does that give to you? And also, do you have any concerns of not being able to provide with us this afternoon a timeline of when these people tested positive for this extremely deadly variant?
So again, that goes with Lauren's answer, the answer that I gave to her. If you want detailed information when these people were tested, when they were not, we can provide that information as long as we don't violate any confidentiality on that case, but I don't have that information. But listen, let's get familiar with this. These numbers are going to increase, and the same way that the other variants we saw 20 and 30 and then 150 and 300. This one is going to be the predominant variant in a few weeks. And this cycle will happen. A new variant will come and it will take over. And the variants that we have seen has been more infectious than the one before. So that's the concern. And that's why we have insisted that younger people should get vaccinated and should get vaccinated as soon as possible. Because our race right now is that we are doing great with the older segment of the population. It's 87% vaccinated, so the people 65 years and older have acquired herd immunity. We have to control now for the people who are between 12 and 17, where parents have the decision, have the power to decide if the child gets vaccinated. And we are encouraging those parents to do so. Although, again, younger individuals do not experience the disease the same way that older people did, we have seen an increase in severity of these cases and hospitalization at the national level, not our level, but at the national level of those variants cases. And that will happen to us eventually. And that's why we have to prepare, and we have a perfect tool. Let's get vaccinated.
And follow up to what Dr. Pino is saying here, every day we receive information from individuals who question the science and suggest that you should not get vaccinated. But I will tell you that every day when I have conversations with our healthcare professionals of well-qualified, very well-qualified individuals, they all consistently say that you should get vaccinated if you have the opportunity to do so. If you fall within that eligible group, we really need to do so. As our youth are re-engaging in a number of ways within our school system and the summer programs, they really need to get vaccinated. Earlier today on our call, Mr. Scott Howard from the Orange County Public Schools indicated that I think this summer they have some 45,000 students who are attending summer school. And that creates, I think, opportunities for exposure. The more that youth are in immediate proximity of one another in significant numbers, we want to take heed to what Dr. Pino is telling us about the variant. He's telling all of us that within the next few weeks, this Delta variant perhaps will become the dominant variant that we see that is creating the rate of infection within our community. And so we have the ability to control that to some extent. And so I hope that our citizens are listening. I believe that Dr. Pino is on top of his game. His staff, his epidemiologists, they have access to a lot of data. And when they look at the data in our own experience here in Orange County with those who have been hospitalized or who have been tested positive, they are telling us and suggesting what it is that we need to do as a community. So we're going to continue to urge that at these types of opportunities. Okay, so there's, the mic has moved around. It's somewhere here in the room. There it is. Okay.
Emily Braun with News 13. This is also for you, Dr. Pino, and kind of going a little bit off of the previous two questions. First we saw the original strain of COVID-19, then we saw B.1.1.7 become the dominant variant. Now we're seeing Delta likely becoming the dominant variant. For those people who are still hesitant to get vaccinated, can you kind of speak to the likelihood of this virus continuing to mutate and continuing to develop into variants that are more contagious, more deadly as we go along?
The psychology of vaccine is so complicated. Just going off a little bit, but to explain the point. For example, we have been yearning for a prevention treatment for cancer for, decades. We got it. It's called the HPV vaccine, Gardasil or whatever name may have. And now we are questioning if we should have it or not have it, the HPV vaccine. It prevents all type of cancer, cervical, oral, esophageal cancer, penile cancer for boys, anal cancer. So it prevents a whole host of cancers. Nothing scares someone more than when your doctor tells you have cancer. It's just a scary thought, just to hear that word. And then we have a tool to prevent it, and there is a percentage that still doesn't take it. And the thing is happening with COVID-19. Its psychology of vaccine is complicated. The 50% goes immediately to get it. Everyone who wants it will go, make the line, wait 3 hours. There were people at the convention center at some point waiting 3 hours to get vaccinated. There were people getting in their knees crying when they got the vaccine. And now that we have the vaccine everywhere, we're having a difficult time for some segment of the population to have the vaccine. And when you talk to them, it's mostly anecdotal stories of some weird side effect that no one heard about it. So it's mostly misinformed. It's misinformation that is spread through different media channels. And I was having lunch today at a Latino restaurant close to our offices in Lake Eleanor. And I was surprised. I engaged with many of them. We know, I go there often, so we know each other. And we speak the same language. And I did a quiz survey. Half of that restaurant is not vaccinated. and it's a block away from our place. And I say, I'm gonna bring that truck, meaning the trailer, I'm gonna park in your parking lot. I'm going to be waving a flag until all of you get vaccinated or shame you into getting vaccinated. I was joking to them, but I was serious in the sense that it's difficult to understand. And they were talking about these weird side effects. This, as the mayor said, this vaccine is very, very effective. This vaccine, they do have side effects, like any other medical treatment. Like getting anesthesia to extract your molar, make half of you faint numb for an hour after. That's a side effect. Like going any other medical procedure, there are risks inherent to any medical procedure. But the risk of acquiring and dying from COVID-19 is a lot higher. And what we don't know about this disease is many people have experienced side effects for a long period of time, weeks and months at a time. Headaches, loss of smell, balancing issues, and we really don't know the whole scope of side effects or effects after this disease that we can have in the future. We have myocardial. It is important. It is critical important for people to get vaccinated. And we understand that some people may have religious concerns, political concerns, but there's a huge segment of the population that has not been vaccinated that is just afraid because they have the wrong information. So look for the right information. Call us, call our calling center. We will talk to you. We will provide you with the right information. Thank you.
This is Melissa Thomas with Florida National News. This question is for Mayor Demings. So I just wanted to dovetail off of what Dr. Pino was talking about in terms of the new age bracket that is the main concern between the ages of 12 and 17, correct? So Orange County obviously did the initiative that was kind of grassroots to reach folks who were not able to move around to make sure they got vaccinated. Then, of course, the truck is now moving around, kind of the I Got My Shot initiative. Does the county plan to do another initiative or project aimed at youth ages 12 to 17?
Yes, we have daily opportunities, and we look to partner with the Department of Health and the school district on various initiatives, and we're not giving up. You know, we have incremental goals that were established. We said that we were optimistic that by July 4th, we would reach that 70% group who would have been inoculated. It does not appear we're going to reach that number, but the number that we ultimately were trying to reach was the 79 or 80%. And so we knew that we have a ways to go to reach that number, or had a ways to go to reach that number. And we will continue to be focused on that effort, and you will see us partnering with some of these community-based organizations like the faith-based community we talked about, like some of these service organizations, fraternities, sororities, particularly in minority communities. We have a number of those planned in the coming months, and so we're just going to remain vigilant in this effort. And we will continue to appeal to you, our residents, to get involved and to help with this process. So you see food distribution drives coupled with opportunities to get a free a coupon or card to go purchase items, retail items in our community. We're going to do all of that, trying to make certain that if we can encourage someone by offering an incentive, we're able to do so.
Steve Hudak from the Orlando Sentinel. If I could ask a question of Scott.
Sure.
Involving the schools. And perhaps you could tell us a little bit, Scott, about how many kids are in summer school, and what the positivity rate is. How are we faring there?
Yeah, so we have 48,000 students right now attending summer school. It's about 5 times as many as we normally have during a regular school year. So we're seeing a significant increase in that. Obviously, getting more enrichment, accelerating into the next school year. And right now, looking at our dashboard over the since last Wednesday, we've seen 15 cases, which, over that time. So, and those are cases that are confirmed cases that we've confirmed either through the Florida Department of Health or have been self-reported and we've confirmed and gone back to them. So they've either sent them to us or not. So seeing a very low number of cases, we're about 44 active quarantines district-wide. We also have about 16,000 employees that would be included in that group on top of the 48,000 students. So quite a large number that are still engaged this summer, and so we're seeing the infection rates considerably low compared to, what we saw throughout the year.
What was our highest?
I think our highest single-day infection rate was close to 100 cases in a day. But, we've significantly seen a decrease in our 14-day daily averages. We've tracked that and looked at that along the way. So it's dropped considerably. But January, February was our largest infection period that we saw, coming off of the holidays specifically.
This next question was texted in from Greg Angel with News 13. It's for Dr. Pino or Mayor Demings. His question reads, it's reported as of May 31st, the Florida Department of Health turned away 5.7 million doses of the COVID-19 vaccine from the federal government due to demand dropping off. Describe the vaccine supply and demand situation in Orange County. How does supply compare to demand?
So we have, it looks like so. We have amply supply of vaccines. I don't have the numbers in front of me, but they are in the thousand. We have the three. We have Moderna, Pfizer, and JJ. To add to that question, no vaccine has expired in our hands. And we actually supplying vaccines from our cache of vaccines to local providers, practices, pediatric practices, and other practices that are requesting vaccines so that we move that inventory before we request more from the state. It's moving. We are supplying the airport. There are some missions with the schools that have been going on, our own, and also we supply with the vaccines. So with that, we have plenty of vaccines. There is more supply than demand. That is for sure, that correlation. But we haven't needed order from the state probably in the last 5 weeks because of the amounts that we have.
This next question comes from Greg Fox with West 2 News. This is for Mayor Demings. His question reads, now that the state no longer requires nursing homes to report data, does that leave people vulnerable, seniors even more vulnerable to rising cases of COVID now that residents and their loved ones don't know about it?
I'm going to ask Dr. Pino to jump in on that, but one of the statistics that Dr. Pino shared today was that I think it was nearly 87% of those 65 plus have been inoculated at this point within our county, which is a pretty good place. They heeded the warnings and they have gotten their patients access to the vaccine. We still need to get additional workers who desire to be vaccinated, and so that's, we're moving. I will tell you also that in terms of news from the state, I think the state believes that we're in a pretty good position. Today, the Florida Department of Emergency Management advised us that effective this coming Friday, they will no longer stand up the state's emergency operations center related to the pandemic. It will cease to operate as an emergency operations center related to the pandemic, and their focus is going to shift somewhat to the hurricane season that we're in at this point. So Dr. Pino can share with you, I think, his perspective on where we are with inoculating seniors in assisted living facilities.
So the infection rates in assisted living facility is the lowest ever. among workers and residents. If I recall the data correctly, when I looked this morning, there were 2 employees and 1 resident in all our long-term care facilities that have been reported to have the virus. I don't know what part of the data he's referring to that doesn't need to be reported. Infection rates, new cases, and testing have to be reported to the state no matter what.
Thank you. And this final question comes from Sam Sosa from Fox 35. This is for you, Dr. Pino. She says the CDC says 323 cases of heart inflammation have been verified in people who received the Pfizer or Moderna COVID-19 vaccine. Has our county had any such cases, and what are your thoughts on this side effect? Is it rare, or should this be a concern?
We got the same question yesterday. We reviewed the data from the CDC, and as far as we can see in the data, and now the data doesn't distinguish between counties, but yesterday when our epi check, there were 28 cases in the entire state of Florida. So as far as we could tell from the data and our abilities to search within the CDC databases, but it didn't report by county, it reported by state. Listen, any side effect to any medical procedure is always a concern. You don't want that to happen, but it happens. And I want the public to understand that also we have seen so many side effects, if we can say so many, because the number of people that we have vaccinated, and that is perspective that we have to keep up and keep our minds open. We have given over 1.3 million doses of vaccines in our county. So if you see here 2 cases of the myocardial issue, it's very little. Now, it doesn't mean that it's not significant for that individual and for that family. It's very significant. That cannot be ignored. But at the population health level, data, talking on data terms, is a significant that happened in that number of vaccine cases.
All right, hopefully we answered all of the questions today. The next press briefing is scheduled for next Wednesday, June 30th at 4:30 p.m. right here at Orange County Administration. Thank you all for attending.